You're watching Beyond Markets and welcome. I'm Kenneth Igbomo, and on today's show, as Nigeria commemorates 5 years since the passing of Dr. Stella Adadevoh, we'll discuss lessons from the Ebola outbreak in Nigeria as the DRC continues to grapple with the virus. You can join the conversation with the hashtag Beyond Markets and also follow my handle at Kenneth Igbomo. Now, 5 years after the death of Dr. Ameyo Stella Adadevoh, who identified and contained the first Ebola patient in Nigeria and helped to curb the spread of the Ebola virus, Niniola Williams, the Managing Director of DRASA Health Trust, joins me to discuss lessons for the future. Thank you so much for joining me on the show today. And first, I'd like to get a sense, since it's 5 years now since the death of Dr. Adadevoh, I'd like to get you to speak on the legacy, on our legacy, and what it means for the fight against Ebola for Nigeria.
Thank you for having me. 5 years has gone in a very quick way. 2014, at the time of Ebola, it seems like it was almost yesterday, but here we are 5 years later, and we are trying to continue her legacy through the organization that we started, DRASA, in her memory, a public health organization based here in Nigeria, trying to look at some of the gaps that still exist and see how we can support the government and work with the general public to fill those gaps.
All right, but looking at this Ebola virus and the very nature of the disease, the virus and the disease and how it comes, it seems the health workers usually are at the front line of, dealing with the consequences. I'd like to speak to, how to help get the attitudes to health workers and people understanding their plight, especially when there's an outbreak.
Yeah, it's very tough. Exactly what you've just said. They are often on the front lines, and they are the first level of defense that the rest of us have against major outbreaks, just like what Dr. Adadevoh did in stopping the spread of Ebola in Nigeria. It's the same around the world. And so a lot of what we do is trying to build their capacity to be able to quickly identify and contain these things while also protecting themselves, because it's very easy for them to get infected in the line of duty.
Looking at the work she did, though, in Nigeria, and, we're all very grateful and understanding, the level of sacrifice that she put herself forward and her team, to ensure that this disease didn't spread further than it did, actually. Looking at the casualty rates, though, in Nigeria, would you say that we are very fortunate to have had someone like her, at this time?
Extremely. I think just looking at the population of Lagos alone, this Ebola virus entering Lagos at the time that it did could have been a national disaster, a complete biosecurity threat for the entire nation. So we need to ensure that we have more health workers that can continue doing what she did, because though Ebola is not within our borders right now, we have other diseases within our borders, and Ebola is still on the continent, so the risk is still there.
All right, then, looking at the attitudes, because if you look back, to the time of this, the Ebola epidemic in Nigeria, where people adopted all the attitudes of hand washing, of getting the hand sanitizers in there. We saw them all over the place. But it seems, we're now in the safe zone, and then we've thrown away some of those practices. I'd like to know the nature of the work you're doing at DRASA Health Trust in trying to help, get these attitudes on board.
Yeah, exactly. So what we're trying to do is remind people that, yes, Ebola is gone. However, the habits that we developed as Nigerians during that time are still very relevant for today, for the same reasons I've just said. There are still things that are threatening our public health, from monkeypox to Lassa fever to yellow fever, cholera. We consistently have these outbreaks. They're in small pockets in different parts of the country, but when you look at the number of deaths in total, they've killed more people than Ebola. So it's still very important for us to do those things. And specifically, the work we're doing is that we go into communities and we engage community leaders, because we find that if we can get those influencers in the communities to understand this, other people will follow their behaviors. We also train secondary school students, because we know that Nigeria's population is very youthful. We have lots of young people who have energy, and they want to have something to do. They want to have a role to play. So we train them to be ambassadors of good health and hygiene in their schools, their families, and their wider communities. And they do a great job of driving those changes. All
right, well, let's look at the future preparedness. We're seeing there's a current outbreak already. It's 1 year on in the Democratic Republic of Congo, where it's looking at, new cases coming on board. We're seeing that it's spreading to a new region. But then one would think that by now, and with the level of the popularity of the Ebola virus, that people around will have been prepared enough to forestall any kind of circumstance of spread.
Yeah, it's a real shame. I think it just reflects the problem we have on the continent, which is that we're slow to react. We wait until there's a problem on our doorstep before we decide to take action. And that's what has happened in DRC. This is not their first, second, third, or fourth, or even fifth outbreak. This is their 10th. And so when you think about the fact that they've had Ebola for so long, it's sad to see that it's taking them over a year to get it under control. But at the same time, this situation is not serving as a wake-up call for many of our other African countries. Many of us are still asleep.
Yeah, but looking at the nature of the spread of this virus, too, it's usually very emotional because you will find that somebody, a close family member, has contracted the disease.
Yes.
People out of care, out of love, want to go and take care of the person, and then you find that it's spreading that way.
Yes.
Do you think more education still needs to be done? Because usually it's easy to say when you're not involved, but when it hits home, it's usually hard to say, okay, I'm not going to look after my mother or my sister or another family member.
Yeah, that's exactly right. And I think especially on the continent with our own African culture as well, you don't abandon your family members, you don't abandon your relatives. And so there are other models that can be used. For example, in Liberia in 2014, there were some international bodies that tested community care centers where they trained people in the communities to treat their relatives in those communities rather than expecting them to bring their relatives to the health centers and the treatment centers that they had. And that found to be quite successful. So I think there are ways that we can accommodate some of those cultural tendencies that we have that can even amplify the outbreak.
Yeah, because I was getting into the cultural tendencies and looking at other things like even burial rights,
Yes.
And how people, carry out all these traditional formalities and how it's also hiding the spread of the disease.
Exactly. Yeah, it's very challenging. And again, our African cultures and communities are very complex. We have, lots of innate things that tend to be drivers of these public health crises. And so I think it's very important that even when dealing with such a crisis situation like this, we ensure that we accommodate those things rather than just trying to stop them, because then you get resistance and mistrust and other emotions come into play that will drive it even further.
Yeah, because when you look at the issue of the mistrust, because looking at the current outbreak in the DRC, you find that there's from the villagers still have there's that level of mistrust. Exactly. In fact, some are thinking that it's the doctors who are infecting people with the Ebola virus.
Yeah, exactly. It's very true. And again, it's an education thing. It's very hard to see a foreigner or a stranger come and tell you something that doesn't make sense to you from your own understanding. And that's why, again, it's very important to engage people in the communities, those leaders, whether they're religious leaders or just cultural leaders in the communities, to be the voice of reason and education for the people in the communities. And that's the model we even use with DRASA Health Trust and the work that we do.
Yeah, because I'm getting into the work that you do, and I'm trying to understand that it requires some giving support and also collaboration and also even sharing intelligence, because you've overseen an outbreak in Nigeria here. And I'd like to know how that is going with collaboration and support.
It's been fantastic. We have both local and international partners, and we believe very much in collaboration. We don't believe that any one entity or group can do it alone. Again, these are complex issues that we're dealing with. You're dealing with human beings and human behavior and trying to change that. And it's very difficult to get a human being to change something they've been doing and they've understood their whole lives. So we definitely believe in partnerships and collaborations, and we welcome others to join us in this effort.
All right, now, so let's get into this current outbreak. Started last year, August. We're seeing so far over 800 people lost their lives so far. Quite devastating. We're seeing it spread. We've seen into some neighboring countries there. I'd like you to speak on how, governments can come together, especially in the areas that are affected. How the Ebola stigma for countries that have the virus can be dealt with in such a way that there's that collaboration seen between borders from countries and helping them to tackle the disease and not stigmatizing people.
Yeah, I think what you've said is very important. We saw a case of this between DRC and Rwanda when Rwanda closed their borders briefly during this current outbreak, just as a response to the fear of Ebola spilling over into their own country. But the backlash of that showed the need for what you've just described, which is the collaboration between countries. If Rwanda would work closer with DRC on monitoring and border control and things of that nature, there wouldn't need to be a reason to close the borders, because in doing that you affect trade, commerce, education, so many other things, because movement of people and communities is also very important to the economies of our countries. And so collaboration is key for us to keep our neighbors as safe as we're keeping ourselves.
Yeah, because when you look at the economic costs of managing a disease like this, the costs come from so many angles. There's so many business decisions that will be held from going into that country, because for so many, they might not come out outright to say it's because of the Ebola virus.
Of course.
But then looking at managing that cost and managing the perception of the disease, because it's more or less more around the perception. I'd like you to speak on what the kind of education that needs to go out more, first at the government level, even to the community level, so that people understand that, it's not a death sentence.
Yeah, I think what you've said is very true, but Ebola has this scary, fear-inducing ability, and I think maybe it's, just lack of understanding, like you've said, and I think we need to look more at the developments that we've seen between 2014 outbreak and this current one. We now have 4 treatments, 2 of which are fantastic, proving themselves to be very effective. We have a vaccine, in fact, several vaccines, one that has also been proven to be very effective. And so there's been a lot of progress made, and I think we need to talk about that more and let people understand that, yes, this is a deadly disease, but that things are being done to ensure that we save lives.
All right, we'll get into some of the new drugs in a bit, but I'd like you to speak on to what you've learned so far in this journey, on managing this disease in the time frame that since you've been involved with the DRASA Health Trust.
It's been very interesting. I think one of the biggest learnings for us has been just the need to, again, accommodate people's beliefs and cultural values. You go into community and you want to start telling them what to do, it doesn't work. You need to bring them on board, let them buy into the idea, let them understand why it impacts them and their own family units. Because if you talk about Ebola as a whole, or Ebola in DRC, for someone in, Kano, it seems so removed. What's their business with what's happening in DRC? So you have to bring it back to the fact that we live in a globalized world. All it takes is for one person to get on a plane and drop anywhere within our borders, or walk across the land borders, for example, and we have a big problem. So we found that really personalizing the message is part of the most important part of the education process.
Yeah, because it's important to the communities, because when you read up on, the initial cases of how the disease even starts in the first place, it talks about people consuming, bats and,
yes.
and but then people who have been eating bushmeat and all of that for many years, to tell them to change their attitude or even the manner in which how they prepare the food. I'd like to speak to how getting that message across is, how difficult it has been.
It's challenging. I'm not going to lie about that. It's very challenging. But again, when you use anchors in the community, people who they respect and trust, who are giving them these messages, and they understand it's coming from a place of love and a place of, wanting the best for them, it ends up having a better result. It's not to say they're going to stop eating the bushmeat, but it's to say that they're now aware of something that they never considered before, and they believe that, oh wow, this thing could actually make me sick. And so they're more careful about the way they go about making decisions about consuming food, cleaning the environment, their own personal hygiene, all of those things that we know are drivers of infectious diseases.
If you're just joining us, Niniola Williams, the Managing Director of DRASA Health Trust, is with me today, and we're discussing lessons from the Ebola outbreak. Thank you so much for joining me on the show again, Niniola. But now let's get into what happened in July and try to understand the effects in how it's going to help to combat the spread of the disease so far. The World Health Organization, they declared this as a health emergency of international concern. From your point of view, how do you see this will affect? Because this new outbreak has actually been on for almost a year. Yeah. It took them about 8 to 9 months before this declaration was made. How is this going to change things going forward?
I think first and foremost it's bringing awareness to the fact that this outbreak has been going on for as long as it has. Unfortunately, though those of us on the continent have been aware of it, many people around the world were not. And so having a body like the WHO make this declaration and announcement has really raised the profile of the importance of this outbreak and how long it's been going on, and the need for people to come together and really sit down and look at how we can tackle this thing and stop it. I think the second thing is also funding, because now that it's a public health emergency, priority of international concern, there are going to be more resources put towards the fight.
So it's going to get more countries aware and then also get more funding in there.
Exactly.
But then looking at the level of funding we've seen compared to the last outbreak, although this is the second largest outbreak we've seen. The last one was the 2013-2016 outbreak. But, comparing how the level of funding and international, drive we've seen on this front, though, would you say it's been at par?
I would say it's been different, and the reason I say that is because the response has been more focused towards the vaccines and the treatment this time, whereas last time we were just scrambling to try and contain it the best that we could. So I think the resources have been applied, possibly numerically more, but in a different manner, using the vehicles of the treatments and the drugs.
All right, because I'm looking at this and I'm trying to understand it better. So the last time we had a more international appeal because we saw that it was in much more countries. We had the countries like the Sierra Leone affected. We had Liberia affected. Nigeria was affected, and then so I think maybe that would have brought more panic.
Exactly, because there was a threat of, wow, this thing could explode all around the world. It ended up in Scotland, Italy, cases in Texas, in the U.S., so it was more of a fear response driven then. Now we're looking more at how can we use science and research to really control this thing in a manner that will help us even for the future. What can we learn from this current outbreak? How can we use these vaccines and treatments to see what we can learn to make sure that we're better prepared next time?
Yes, because getting into the new vaccines, it's very, very good news to hear. We're seeing that 2 of these new drugs, they are increasing the survival rates by about 89% to 94%. Before now, it was more or less managing people until they passed on.
Exactly.
But now we're seeing that it's been coming up there. But I'd like you to speak on this, on this success rate of the survival rate of these new drugs and what it means for this fight going forward.
It's very impressive, and we're all very excited to see this progress. I think when we think back to 2014, the previous outbreak, we think of even just the health workers who put themselves at risk and didn't have access to any vaccine at the time, and many of them, we lost them in the process, including Dr. Adadevoh. So when I think about that, I think, wow, this is a great achievement. However, of course, there's still more work to be done. This is just a trial, and we have to see what are the long-term effects and so on, things like that. But for now, it's a great achievement. Yeah,
we've seen some other drugs though that came in there, but they didn't quite meet par. The case of Zimap and Remdesivir, the other drug that was on trials. But you think there should still be more trials because we understand that this disease has many strains.
Yes, exactly, and it can also mutate. It can change over time. So I think it's very important that a drug like Zimap was the talk of the town in 2014, and now we're finding it's not been effective in DRC in this current outbreak. But that doesn't mean that more money shouldn't be put towards developing it further, because there is something there that worked once upon a time.
Yeah, but I'm looking at the incentive though for the pharmaceutical companies. This is a different type of disease. It's not like the type where you like malaria, for example, that people have it and then you can. I'd like you to speak on what is the journey these vaccines are going to take before they can get on the shelves and people can buy them.
It's a long one. To summarize, it's very long, and I think you've hit the nail on the head by speaking about the incentive for the pharmaceutical companies. These Ebola vaccines and treatments are sort of a social impact project for them. These are not things that are going to bring in big bucks. When you think of things like diabetes medication, hypertension medication, those chronic illnesses that people need to take medicine every single day, those are the things that bring in cash for these pharmaceutical companies. Developing a vaccine or a treatment that may not be used for the next 5 years until the next outbreak, it's not so lucrative for them, which is why we're so thankful that they are still putting the money into this area. And so we just hope that they continue to do so we can develop this further.
Because for now, it's just more or less they are just available for compassionate use.
Yes.
Okay, so now let's get into the vaccination campaigns we've seen. We've seen like Burundi step up.
Yes.
We've seen they've done massive vaccinations already, preparing just in case for anything. Should it be what the neighboring countries around the DRC should be doing?
Absolutely. I mean, again, this is part of being prepared and waking up and realizing that, wow, this is happening just across the border from us. We need to wake up. We need to be prepared. We need to assume the worst, which is that this thing will cross over into our own country. So it's very important. But again, there are lots of factors. It's complex. You have to have the political will. You have to have the budgetary resources to get the vaccines and so on, and also a strategy to actually implement the vaccines. One of the vaccines requires 2 doses, so that means you have to track people and make sure they come back after the first dose within the specified time frame to get the second dose. So logistically, it's also quite complicated, and not every government has a structure in place to be able to distribute and disseminate those vaccines.
Yeah, because the area of contact tracing, I think that would be the most daunting task, because we've had instances where sometimes even we had cases that were not that caused panic, and then we found out that they were not genuine. There was a case of the fishmonger woman who was reportedly to have had the disease, and she was and had they traced her movement to a market. Later they came to recount that position.
Yeah.
But then managing that level of information and managing how you are tracking people and ensuring that they get to come back, I think it requires building trust.
Fully.
And I'd like you to speak on that, because it also takes some level of expertise.
Fully.
So that knowing where people went, their tracing and all of that. I'd like you to speak to that and how cumbersome it is to manage that experience, judging from the experience that we had in Nigeria.
Yeah, it's very difficult. I mean, even here in Nigeria, we had a case that escaped from Lagos and went to Port Harcourt, and then we had another cluster of cases in Port Harcourt, Rivers State, because of that one person that ran away. And again, why did he do that? He was afraid, and he felt he could get better treatment somewhere else. So managing people, again, and trying to change their behavior and control them is always a difficult thing. And then when you now add that within the context of a very fearful situation where people are afraid for their lives and the lives of their loved ones, it's quite complex. But what I can say is that it's important to try and build that trust, to be able to take on the task of contact tracing, because people move constantly for work, for school, for various things. And so to be able to have the ability to trace those things, it requires a lot of coordination. And a lot of these countries end up having to set up massive command structures and spaces where they're literally tracking one by one every single person that could possibly become an infected case. It's hard work.
Because looking at it and thinking now, first, the incubation period for the disease is about 21 days.
Yeah.
So it means, and I'm trying to imagine in the minds of people who have their daily lives to live, and then, for example, because they came in contact with somebody, then they have to hold them for about 21 days, to check them to see if they show symptoms of the disease. But I would say it's worth the wait.
Absolutely, it is. However, some others would argue that, trying to quarantine people and control their movements is unethical. So there are 2 sides to every story, as we know. But I think at the end of the day, the contact tracers have an immense job. And many of them also have social science backgrounds, because there's a lot of psychology involved in getting people to trust you and believe that you have their best interests at heart, especially in these outbreak situations.
All right, then. So let's get into the attitudes of the neighboring countries, and how they can galvanize support for each other, especially in the event of contact tracing, because now when it has to go beyond borders, it's now it's a kettle of fish. Yeah,
I think we definitely need to improve our communication across borders. We saw the cases in Uganda, for example, coming from DRC. It's worrisome to think that, maybe there could have been something done to prevent that, but needless to say, it happened, and Uganda was able to send those cases back to DRC for better treatment in DRC, because they weren't quite prepared to deal with those cases. So that's an example of a successful collaboration between 2 different countries. But again, that's at the point of crisis. We need to improve those communication structures now, today as we speak, before we have the disaster happen.
Yeah, because when you look at the work, the agencies like the World Health Organization and other medical agencies and organizations such as yourself who have been working on this one, it's quite an incredible task that you've been putting together on this fighting this virus. And looking at funding though, should countries, because now we understand that the vaccines are available or some level of treatment is available, is it the right time to pass on the part of the funding to say, okay, countries can even support financially in helping to treat some of these cases?
Yeah, 100%. I think there should be a place in every national budget for both preparedness and response activities, because we live in a world now where we're constantly seeing outbreaks. If it's not Ebola, it's something else. And so we need to understand that this is now a part of our lives. Whether you live in the United States or you live in South Africa or you live in Tanzania, wherever you are in the world, these things can reach you. And so every government should have some budget set aside specifically for this issue.
All right, then finally though, as we're looking at the 5 years since Dr. Adadevoh, I'd just like you to one more time just touch a little bit on what her legacy means and looking at Nigeria and how we can prepare for the future.
Yeah, I think a lot of people have celebrated her very, very warmly in the last 5 years. And she was someone who loved this country, loved Nigeria. She was a patriot and she loved her job. And I think the most important way to memorialize her and her team and all those that sacrificed during Ebola to stop it from spreading and to save lives is to ensure that we are prepared, that we don't sit down and rest on our laurels and just assume that we're safe, because we're not. These things happen every day, and it just takes one person to spread it. So I think the most important thing to remember her and all those others that lost their lives in the West African outbreak in 2014 is to just remember that these things can always come back, and what are we doing as a country to be prepared.
And that's it on Beyond Markets, and thank you for joining us. Remember, you can watch the show at 5 p.m. West African time daily and have access to all the previous episodes of Beyond Markets on our website. That's at cnbcafrica.com. You can also stay engaged with the hashtag Beyond Markets and follow me at Kenneth Igbomo. Do have a wonderful day.